Well, my name is Mike McKirdy. I'm a consultant breast surgeon based at the RAH in Paisley, but I also undertake clinics at Clyde Royal Hospital in Greenock. I work in a team of specialists who have an interest in breast disease, breast cancer in particular. The biggest challenge for us in breast disease in the area is the number of people we see to try and diagnose a few of them who actually have a breast cancer. So in my time over the past 20 years, the number of people we see in the Clyde area, between the Vale of Leven Hospital, Clyde Royal Hospital and Paisley, has jumped up from 3,000 women a year coming to see us to 4,500 women a year. That's a big increase, 50% increase in the number of people we need to see and diagnose problems at our clinics. And in that same period of time, the number of people with serious disease with breast cancer has gone up by about 4 or 5%. The difficulty and the challenge for us is dealing with that number of people, being able to reassure appropriately and also find those who do have disease which needs to be treated. I think one of the biggest changes that I've seen in my time as a consultant over the past 21 years is increasing specialisation. So when I was first appointed as a consultant, I might have operated on somebody with a bowel problem or a gallbladder problem, as well as women with breast problems. These days that would be unacceptable practice, and so we, as teams of surgeons across the health board area, have developed special interests, and so gallbladder disease will be dealt with by those who specialise in that, bowel disease will be dealt with by those who specialise in that problem, and in my area of breast disease, we now have specialist teams who only deal with breast disease. As well as our specialisation increasing, the equipment that we use has become more specialist. So my colleagues who deal with bowel problems need to have specialist equipment for that, but we too in the breast service have to have specialist diagnostic equipment, specialist equipment we use in the operating theatre, and we have to build specialist teams who know how to use that specialist equipment and work together. And again, it's not possible to deliver that service from every hospital in the health board area. Because we have developed specialist teams with particular disease interests, we know that that has helped improve the outcomes for our patients. At that time, going back 30 years ago, we would have expected the outcome for our patients who were newly diagnosed with breast cancer is that half of them would have died of their disease by the time we'd followed them up for 5 years. In other words, only half of our patients were alive 5 years after their diagnosis. These days, we know that that figure is going to be about 90%, 9 out of 10 patients will be alive and well 10 years after their diagnosis. So that's a huge change in the outcomes for our patients. Because patients are being looked after by teams of surgeons and oncologists and radiologists who specialise just in that area, the correct treatment is given for that individual patient because we know all there is to know about that particular area of surgery, and we then are able to look after our patients most appropriately. Moving forward together for our patients in Greater Glasgow and Clyde is to discuss how we best deliver those services so that people are seen and diagnosed quickly if they have a serious problem, get the very best care in the very best place for that care to be delivered. And we therefore need to have a conversation with our communities and those who are our patients in the future and patients that we've looked after in the past to shape those services so that they are the most appropriate services as we move forward together into the 2020s.